Ating kausapin ngayon si PhilHealth Senior Vice President for Health Finance Policy Sector, Israel Francis Pargas. Good evening, sir. Thank you for joining us tonight.
Good evening, Pia, and good evening to all.
So, sir, can you tell us, Senior Vice President Pargas, what is intact and what is in danger? So, after yung nilabas nila, meron pa bang ilalabas? Is there other data? Are there other data that are in danger?
Well, one thing is, according to our initial investigation, the members' data, the contributions data, the claims data, which are all in our databases, are all intact. So we are seeing that there are no leaked personal information or medical information that were compromised. But again, as said, during our initial investigations also, there were around 100 workstations or the personal computers of our issued to our employees, which were actually attacked or also affected by this incident. And so there could probably be data that were taken from them, just like their personal information. That's why dun sa sinasabi ng mga data na nasa dark web ay mga ID ng ating mga personal or mga ating mga employees. So, nagpalabas na rin kami ng notice to the public in cases, however, because we are still looking deeper into this, in cases that there are any other data that should have been compromised, ay ipaalam ka agad sa amin or sa PhilHealth through our phic.dpo@gmail.com upang magawa natin ng paraan. But so far, again, Tia, what we are saying is that the databases of our members and our patients are all intact and not affected.
Sir, I hope I get this very clearly. No? Let's make this very clear. Sabi po ninyo, in case there is other data, so you're telling us, even if, kasi parang opposite yung sinasabi po ninyo. Sabi nyo, intact naman po yung members' data, contribution data, but in case there is other data that could have been compromised. So, ano po talaga? May na-compromise po ba na
again,
members' data or what?
No, because again, there were other workstations that have been infected and that were attacked by this incident, just like the workstations of our employees. So probably there could be some data in there, but we still don't know yet what are these data that were actually attacked. But so far, what we know is mga personal data ito ng ating mga empleyado at ng ating mga empleyo. But we are still finding it very hard and looking very hard to see if there are still more data or some other personal data that could include our members. But ang sinasabi rin naman namin is really the databases of our members and our patients are all intact. And so we're saying na baka wala naman na nag-leak doon. Yes.
So you're just being careful, cautious about this, but it, para bang it doesn't really encourage confidence because you're saying na intact pero baka kasi meron. So yung I'm sure there are some people who feel who are apprehensive about this. Medyo natatakot na parang baka nga may lumabas pero intact pero baka may lumabas.
Because how the Medusa or the ransomware works, they're actually threatening us and demanding even payment of the data that they said that they have, and they will try to spread them out if they are not going to pay anything anymore. And so we are also, of course, waiting if ever there are any other data that we are able to get, other than those which were initially presented as personal data of our employees.
Are you saying, sir, that there could be a second tranche of release of data na pwedeng mag-release ulit ng data sa dark web?
Well, they are saying they can, and that's why we also went into public, providing a notice to the public that if anything that the public would know or meron silang makita na mga ganito ay i-report kaagad sa amin upang ma-check din po natin kaagad ang ating systems.
When we talk about systems, sir, are you very confident about your systems? And at the same time, have you looked into an inside job, for example? Did someone from PhilHealth, did people from within PhilHealth help this group?
Well, for now, with our systems, we are being helped by different government agencies and experts like the DICT, the Cybercrime Unit of the PNP and the NBI and the National Privacy Commission in order for us to put enough control and monitoring tools to make sure that this does not happen again. Actually, currently, PIA, the National Privacy Commission is also investigating us, looking deeper into what's really happening with regard to our system, and actually looking if there is any negligence within the corporation or within our people that might have caused this incident to happen. So we are looking in all of those aspects, actually.
Okay, so you're checking if there is negligence or if there was outright cooperation by PhilHealth employees doon sa mga nag-hack.
Yes, we are not saying that there is, but we are not also
Discounting that possibility.
removing the idea that probably it could happen, and so we are looking into all of these cases. Yes.
Well, can you give us an idea of the result of the initial investigation now that you're saying na tinitingnan nyo rin, no, kung merong involvement ang PhilHealth employees mismo? Is there some initial result for this investigation?
Sa ngayon wala pa. We are still in the things in the investigation together with all other with all other agencies, and hopefully once we have the result, we will make it public.
All right. Maraming salamat po sa inyo, Israel Francis Pargas, Senior Vice President ng PhilHealth.